He was the only surgeon out of 6 surgeons that I visited to find out about my issues that was very positive and that said I could continue all the activities I was currently doing.
What condition did you have that made you seek medical treatment?
Well, I was born with hip dysplasia, which I didn't realize I had, and then I ran a marathon, which was very stressful on the body, and then I went through menopause. And so after that hormone change and the activity that was very enduring for 26.2 miles, I started having lots of pain. So it took me about 4 years to discover that both hips had hip dysplasia, where I was born with the hip joint sitting out just a little bit. Most are born way out, but I had that slight dysplasia, and it caught up with me in my mid-50s. And Dr. Sands was able to point that out to me and help me get my life back with new hips. Being a yoga instructor and former competitive cheerleader is my history. I was able to tolerate pain significantly. Every surgeon that saw my x-rays and my MRI were like, why haven't you been in here a lot sooner? I was able to tolerate the pain through the practice of yoga and learning how to control pain through your mental awareness. So I was able to keep going with some physical therapy and exercise and strengthening the muscles and get back into it.
How was your experience with having this surgery?
I had a great time in this surgery, believe it or not. It was the first time I'd had any type of surgery. I've not had children or anything. It was my first experience in a hospital. And he was great. He was right by my bedside, when I woke up, and his physician's assistants, Dr. Joe, was there. I felt very secure and well taken care of.
What was the recovery process like, and how long did it take you to get back to normal life?
The recovery process was just a little bit of physical therapy right after. I was walking immediately. I had physical therapist in the hospital and physical therapist at home, and then I saw a physical therapist after that. And I wanted to go through that route as a yoga teacher to find out what type of therapy they would recommend for people with hip problems, because I had several students that had already had hip surgery, and then several students who were talking to me about the potential for hip surgery. And so I learned from their experiences and then wanted to also go through that and experience it. So after the physical therapy and the continuation of being active, I was able to get right back into yoga class 4 weeks after my surgery.
What, if any, pain level are you experiencing after surgery, and would you recommend First Choice to your friends?
Pain? What is pain? No more pain, thanks to Dr. Sands. It's been an incredible experience. It's been so great that it's like I didn't even have hip surgery, because I've been able to continue with my life. I have encouraged several and referred several to Dr. Sands, and we're glad that he's around and that he's here in our area, and that we have such a great surgeon that has a great positive attitude and a real concern for people. That was the #1 thing that I noticed when I went to 6 different surgeons. He talked to me. He answered my questions. He was there for me whenever I needed him. He was so personal. He gave me his cell phone number so that I could stay in contact with him.